in my area cold. Dark skin, light skin, medium tones. Pumping braids got mini afros. Thick lips got hips, some of us don't. Big nose contours, some of us won't. Never wanna put us in the media, bro. Want a fat booty like Kardashians. Want a fat booty like my auntie got a yo. We like the blood clot, tell her reload it. I've got the camera, my girls are posing. I need some backup, then my ones are rolling. Grown women things, I'm never at risk. Mind my own business, I'm never in mess. Who am I? I ain't bae, get a slice of the cake. Want a house with a view and a new pair of shoes. Keep it real from the jump, Gucci gang, little pump, little vibe, little bass, little kick, little snare, little lies, big truths. Do you? They don't care. Do you? They don't care. Get your ass at the box and build up from there. I don't have a gang with me, but I still walk with a gangster lean and rock Nikes cause we think they're clean. MJ leather jacket, beat it Billie Jean. MJ leather jacket cause I think I'm bad. That's cool. I like it. The growth, the light, the pain, the fight. We love, we fight, we hurt, we cry. He paid the price. You'll be. I think I need some time away. I took a little time. I pray we gon' be alright. Okay, alright, okay, alright, okay. I think I need some time away. I took a little time. I pray we gon' be alright. Okay, alright, okay, alright, okay, alright, okay. And you said there's pink black girls, not area codes. These black girls need to be in the shows. Be on the runways, not just mood boards. On top of that, we got a steam in your team. Look at your crown, natural, relax at a Jericho. One time soft and sheen. Where black girl magic is sometimes blue. Might broke a hairband or two. Raise my voice, you're gonna say that I'm angry. Kiss my teeth, I know you say that I'm good. Kid at 16, you say it's my destiny. Driver range, you think I'm up to no good. Give us a break and let us breathe, man. Give us a chance, let us achieve, fam. And I know that my hair looks a bit different today, so don't touch my hair. Like, new hair, who this? Old black bomber jacket and a band to twist. Look, mind over matter, I can handle this. We're fine, took a second of awards in risk. See, I think that I care too much, but all listen cover, see air. 2 cups, I've got nothing to show, but you love, check my flaws and all my trials. I was black back when it wasn't even in style, that's cool. I like it, the growth, the light, the pain, the fight. We love, we fight, we hurt, we cry. He paid the price, you'll be. I think I need some time away. I took a little time. I pray we gon' be alright. Okay, alright, okay, alright, okay. I think I need some time away. I took a little time. I pray we gon' be alright. Okay, alright, okay, alright, okay, alright, okay.
And again, similar as 8.
Ladies and gentlemen, if you could take your seats. It's always good to hear you networking, but we must get on with the next session. First of all, can I just say thank you to everybody for respecting the 2-minute silence downstairs. That means a lot to me, and I know it means a lot to many of you in the room, to respect the sacrifice that so many people have made historically on behalf of this country. So thank you all very much from me for doing that. Tim made a statement this morning about the importance of the work that CCN does lobbying and representing some of the key issues that we all have collectively. And a great example of that is the work that's been carried out over the last few years in partnership with Newton in terms of adult social care. I think that most of you will know that adult social care is the proverbial burning platform on most of our budgets. It accounts for about 2/3 of your budget, depending on exactly what sort of authority you are. And within that, working age adults account for a further 2/3 of that 2/3. So today we are launching a major new piece of research that's been carried out, working between CCN, Newton, but not just Newton. What we have done is run a series of workshops and panels in partnership with many of the experts in the field, not just the LGA, but providers of care. We've even had representatives, dare I say it, from the Treasury there, and from the department, trying to pull that knowledge so that everybody collectively could arrive at the right results that everybody felt really did reflect the situation. So what we want to do is move the focus not away from, per se, but to broaden it from just the focus on the elderly as the mental picture of adult social care, but very much towards that wider picture that also includes people of working age and people with lifelong disabilities who are such an enormous part of the adult social care expenditure that we have. We want to change that narrative from just the elderly to that much broader picture. And I'm delighted today to be joined, obviously, by Danny Sperrin, who is the partner at Newton, who oversaw the entire work that we did on that, and indeed some of the previous work we've done. And extremely delighted, genuinely, to have Steve at Kinnock MP here, who is the Minister of State for Care, who will be responding on this. And I think you can spot the Labour Council representatives in the audience. Yeah. They're both down there in the 5th row.
The noisiest ones.
They're noisiest and the rowdiest ones, particularly in the bar later tonight. But being rather serious for a second, I mean, what we need to do is make sure that actually we change that agenda, because one of the things that's become very clear is actually within that social care cost, the cost for the support of people of working age and with lifelong disabilities is rising particularly rapidly. It has increased over the last 5 years by 1/3. And some of the research that Newton has undertaken that we're going to be launching today, and you'll all have a copy of that report, hopefully on your seats as you came in, says that actually, if nothing else is done, nothing changes, that by 2030, the costs per council will have risen, the costs to councils would have risen by £6 billion a year, £6 billion extra a year, taking it to £17 billion a year. So that's an enormous financial challenge. And if you go back to what Tim said this morning, as county areas, if you compound that, if the government does make changes to the way in which funding is allocated, moving it predominantly away from more rural areas towards more urban and city areas, our ability to meet that financial challenge is compounded again. Add on top of that the changes on things like the national living wage as well, which is increasing the cost for many of our providers. There is a real double whammy in terms of the demand and the cost pressures being faced by us all then. So if you think that record expenditure, though, is a really good thing because actually we're improving the outcomes for those people, I've got some really bad news. When you look at the report, you actually find that those outcomes are not improving. Those individuals are still experiencing really severe challenges in relation to key metrics like education, employment, and health. And actually, when the research was done talking to those individuals, their own feedback was that they felt that they wanted more contribution from themselves to the sort of care that was provided and far more independence than most councils actually gave them. This is bad for councils, and it's bad for the care users themselves. It's very clear we can't go on as we have been, which is why County Councils Network, starting today, is calling for reform of the whole system. We need to make it more sustainable financially for local authorities, but we need to also improve the lives and the outcomes for those people with working age and lifelong disabilities as well, making sure that their employment, their education and health outcomes are significantly improved. And I mentioned to Stephen just before we started, the government has talked extensively about the national care system that it wants to introduce. At the moment, frankly, I don't know what that means. It could mean a lot of things. I don't mean that disrespectfully, I just mean that as a statement of fact. Are we talking about a care service similar to the NHS, which will be directly managed, funded and controlled by national government, with people in employment by national government, or are we talking about a loose framework that sets maybe standards across the country? I don't think many of us in the room would know the answer to that. I'm sure that is work in progress with the national government. But we do need to understand that relatively soon to help with the planning of where we go from here. So caring for working age adults and those with lifelong disabilities, I think is one of the most important aspects that we have collectively as councils in this room. It's a pressure financially, but it's also a moral responsibility that we have. We need to improve those outcomes, make this system sustainable. And that's why today's research that we're launching is of such momentous importance. And therefore, I'm going to hand over now to Danny, who's going to give you the top-level outcomes from that research. It's the first phase of a two-stage piece of research that we'll be building on next year, after which I'll ask Stephen to respond on behalf of the government, and then there'll be time for a Q&A with everybody in the audience. So, ladies and gentlemen, please welcome Danny Sperrin to the council.
Okay, good morning, everyone. My name's Danny. I'm a partner at Newton. I look after our work in social care. It's a huge privilege for us to be here, to be continuing our partnership with County Councils Network, building on the previous work we've done together around social care, and building on our work done with a number of your authorities as well in sort of major change programmes across social care. Thank you for having us here at the conference, and really sort of pleased to be able to stand here talking to you today about some of these really important issues. So this piece of work is really about changing the conversation about social care, as Martin said. Working age people for a long time, for too long, have not been a core part of the debate about social care. And so the purpose of this work is to really examine how do we support these people, how do we support working age people, and how do we improve the outcomes that we deliver for them. And so we want to put working age people right in the middle of the debate. Really, up until now, most of the conversation about social care has been about older people. Whether that's about hospital discharge, the concentration on hospital discharge, really we're talking about older people there. Even a lot of the recent work around charging reform, that's really been talking about changing the amount that older people contribute towards their care. The impact on working age people has always been very, very minimal. And in fact, if any of you have seen any of the coverage, I've been really pleased to have some great coverage in the press this morning. A lot of the national papers have picked this up. Stock imagery is almost all of older people on Zimmer frames or etc. So we're not in the working age people are not in the national conversation. It really underlines that point. So to pull this piece of work together, we've had the huge privilege of working with 16 CCN authorities who have been really generous with their time, their data, and their input. And we've had an expert reference group that have overseen this, chaired by Martin, with leadership from Pat Flaherty for ACCI, as well as input from DASs, DCSs, finance directors, partners in the healthcare and voluntary sector, and key central government departments as well. Demonstrating, I think, how important this is, we've had 60 people or more contribute their time, and we've had a whole number of roundtable discussions, including some excellent cross-government discussions with DHSC, DWP, DFE, and the Treasury. And we've also engaged extensively with people with lived experience. So we've had a couple of lived experience panels, and MENCAP have been a really important partner to us in helping to pull this work together. So firstly, who are we talking about? Who do we refer to here as the kind of working age population? Really, anybody aged between 18 and 65 who requires some form of social care support, together with some who have lifelong conditions. So it's a wide range of people with a wide range of conditions and disabilities. Typically includes adults with learning disabilities, mental ill health, and physical disabilities. So firstly, we want to be really optimistic for these people and think about how we can help them to have great outcomes and live actually pretty ordinary lives like the rest of us. And it's true that right now we aren't really achieving that. So there's some quite stark stats up on the slide there. So in general, life expectancy is 20 years shorter if you have a disability than for someone who doesn't have a disability. Nearly twice as many deaths are classified as avoidable compared to the wider population. We have 2,000 adults with learning disabilities still in long-stay mental health hospitals, long-stay hospitals, where on average you stay for 5 years. And if you have a disability, you're 2.5 times more likely to leave education with no qualification whatsoever. And MenCap sort of summarise these challenges by saying, in short, people living with disabilities have less of a life, are less able to be social, typically have fewer friends, and are less likely to be in a relationship. So not only is this an opportunity to get better outcomes and improve outcomes, we're also spending, as Martin alluded to, more and more money every year in supporting them. The working age population now account for 63% of net spend on adult social care. And yet, as we said at the beginning, we're always really debating support for older people. So this actually makes it the single largest area of spend within local government. And spend is growing more quickly. These slides are available in the app, by the way. Some of the legends, I appreciate, are quite small. What you can see in the bottom right-hand corner there, that orange line is the rate of growth for supporting this cohort. We see it growing ahead of other areas of social care, ahead of CPI, and ahead of the rises in the national minimum wage. So 32% growth since 2020, about 10 percentage points ahead of CPI. So costs are rising faster than we should expect them to. And actually, the pressure is not coming only from rising prices and rising unit costs. Everybody in the room will be aware of pressures in SEND, support for young people with special educational needs. We're now starting to see those people grow into adults and transition into adulthood. Yep. Our research says around about 20% of people with an EHCP will be eligible for ongoing adult social care. So unmitigated, that looks like up to a 29% increase in demand for adult social care as those young people transition into adulthood. Perhaps as important, there'll also be a significant number of those people who have an EHCP today and won't be eligible for adult social care support, and as it stands, there is very little in terms of ongoing care and support for those people as they go through their adult lives. So significant pressure, say, both on unit costs and coming in terms of additional demand. Very conscious of this, a very broad group of people, a very broad term. We're talking about, say, working age and lifelong disabled people, covers a huge number of different conditions and disabilities. And therefore, as part of this analysis, we've looked to draw out different cohorts of people to allow areas of focus and allow us to think about how we might target different outcomes, manage different needs, and come up with different solutions. What this analysis is trying to show, with each circle being a different cohort of people, we have average weekly cost at the left-hand side and growth in cost, average annual growth in cost along the bottom. What we can see is some cohorts of people are not particularly well controlled. So we have in the top right-hand side, we have a group of people who are averaging close to £3,500 a week to support and growing at over £1,000 a year in terms of cost. 6% of the population up there accounting for 20% of our resources. Give a little bit more information about this group just to help bring to life who they are and also how that leads to some of the conclusions that we start to draw in the report later on. So these are people often who have maybe 2-to-1 or 3-to-1 levels of support. We see very high costs. We actually see providers quite reluctant to offer support always to this group, fear of kind of challenging behaviours, challenge to meet those needs, questions from CQC and others. They're a group who are generally underserved by housing, and so we see very little suitable housing provision nationally. And these are people who are going to be living in perhaps residential or nursing care for a significant period of their life. A third of those people are in their 20s and 30s, so have a lot of their life ahead of them. So if we take that whole picture together and if we carry on with the system the way it is, we'll be spending, as Martin said, 50% more than we are today by 2030. That's that extra 6 billion, or it's 10 billion more if we look ahead by 10 years. Clearly, there isn't the public finance to support that, but I think perhaps more importantly, and hopefully as illustrated so far, is that it doesn't represent good outcomes for people and what we'd aspire to be achieving for these people. But perhaps the exciting opportunity is that if we can help people to access the right education, employment, housing opportunities, there's a greater opportunity to live, live an ordinary life that most of us would aspire to, and as well as that, mitigating the cost of supporting this group. So not only would that help achieve better outcomes, help mitigate the cost, but also make them more likely to be contributing to, in terms of employment or in terms of supporting their local community. And this is what people tell us that they want to be doing. So it's an exciting opportunity, but does require significant transformation in the way we provide support and a shift to being much more aspirational for this cohort. This won't happen without significant concerted effort and collaborative working between local government, central government, the NHS, private and voluntary sectors, all of those working together. And so this report has sort of set out two groups of recommendations, one to think about in central government and one for local systems. So in terms of nationally, the first point we want to make is as we've made throughout today, to bring this group of people to the centre of the debate about adult social care. Nearly 2/3 of our resources now supporting this group and outcomes that we'd seek to improve. So we want to have working age people right in the middle of the debate nationally about adult social care. As we've said, it's all been about, not all been about, a lot of the national conversation has been about older people up to this point. We'd like to see that shift. Linked to that, we need to have a discussion about what is it we're aiming to achieve for working age people. What do really good outcomes look like? There's some bits alluded to as we've gone through the presentation. Work from Social Care Future and others describe this, glorious ordinary life. What does that look like? What is it we're trying to achieve? If you open up the report, there's a great timeline in there which shows how our support for particularly people with learning disability has changed and transformed over time. Times of asylums and long-stay hospitals are actually in relatively recent history. So if we look at the progress that's been made in terms of outcomes for people and the way we support, the potential to continue to make that rate of progress is really quite exciting if we can have a good conversation about what it is we're aiming for. We call housing out quite strongly. There's no doubt that the right sort of housing would be transformative. We have significant numbers of people supported in supported living, who could be living in more independently in their own home. And we see that over-reliance, say, on really overly dependent care, whereas, say, housing would be a better alternative. And with housing clearly so front and centre of the current government's agenda, it really feels like the right time to be making that case. The fourth point, analysis in this area was a real challenge, in terms of the depth of the data available, the consistency of it, the accuracy of it. Again, perhaps since maybe not having the same focus as data around older people. So really, as a starting point for us to have better insight and be better able to support these groups of people, we need to do some real work on the way that data is collected and reported nationally. And then clearly, we've made the point about the significant increase in costs if we do nothing. So the way this support is funded needs to be addressed. If we move across to local systems, what can we do locally? Well, this can't be a case of trying to copy and paste solutions from older people. We need to draw on that discussion about what do good outcomes look like, being really ambitious and optimistic about what we're trying to achieve for these people. And so some whole system change is what's required at local level. A key part of that needs to be addressing provision from the private market. We showed you that kind of increase in cost, 32% increase, 10 percentage points above CPI. So we're seeing significant additional cost coming through the private sector and private providers. And so we need to take a really collaborative approach at rethinking how that market's working. We need to look across, we need to be developing a system that maximises independence throughout somebody's life. So we talked about transitions and we called that out as a final recommendation there, but looking through somebody's life, actually some of the points where people's support and level of independence really drops are quite predictable. So talk about transitions as one. We also see when people's parents are ageing, they might typically be in their 40s. We see a real loss of independence and a climb in the level of support required. And again, that's predictable. So how can we work more preventatively to be able to maximise independence throughout somebody's journey? And as I said, the focus on young people transitioning to adulthood. It's always been a focal point, but with the rising numbers of young people with education, health and care plans, this really has to be addressed as we see those young people with special educational needs grow and transition into adulthood. So there's a lot there. Hopefully you'll find time with a coffee to read every page of the report. This is only phase one, so there is more to come. So really what we've sought to do here is to just bring together some of the emerging evidence, to bring this into the national conversation and to start to shine a light on it. We're going to be moving to phase two after Christmas, and we're really going to be trying to get into some of the discussion about what do we do then about this? What does good positive change look like? Can we address some of those questions around housing, new models of care, and working differently with the market? And we'll be looking across the sector for examples of the brilliant work that we know and can see is happening up and down the country. That'll be coming out probably in the middle of next year. That's everything I was going to say. I'll hand over to the Minister now to give their reflections.
Well, thank you very much, Dan. That was absolutely fascinating, and good afternoon, everyone. It's really lovely to be here, and thank you for the very warm welcome that you've given me. It's such a privilege to be with you here today. I know you're all so committed to public service and to improving the state of our public services, and you play an absolutely vital role in that. And of course, what we're talking about in this session is at the heart of the challenges and the opportunities that you're facing. We have to ensure that younger adults draw on support. We have to ensure that older adults with lifelong disabilities that draw on care are actively included and prioritised in our plans for reform. As the voice of England's counties, you are an excellent example of cross-party partnership, and it's essential that we harness that spirit of partnership as we move forward to reform adult social care. I'd like to thank the County Council's network and Newton for working together to produce such a comprehensive report on younger people and those with lifelong disabilities who draw on care and support. The report rightly points out that older adults facing declining health, frailty or dementia are often the focus of our national conversation on adult social care. Now, they are, of course, incredibly important, and it's right that we talk about them as much as we do, but they are not the whole story. As your report recommends, we must talk more about younger and working-age people with lifelong disabilities, and we must make sure that they are at the heart of our national conversation about adult social care. Accounting for 40% of all people who draw on care and support, working-age adults with a disability or lifelong condition are an integral part of our adult social care system. Now, as the report notes, national expenditure on this cohort has risen by over a third in the last 3 years, and I recognise the growing financial pressures that this is placing on you, on council budgets. Now, at its best, social care has to help people to live enriching and gloriously ordinary lives, supporting them to participate in society and access employment opportunities, as well as support family carers. We must make sure that every person that draws on care and support is seen, heard, and is an active participant in our plans for adult social care. And as this report rightly points out, that means working closely with other public services to support people through every stage of life. This includes children's social care to address the challenges people face when transitioning into adulthood. Each person that draws on care and support is equally deserving of our focus, our resources, and our commitment. They are our neighbours, our colleagues, our friends, and our family, and they are all key to our government's vision for adult social care. This government stood on a manifesto to reform the sector, to build a national care service, and to improve care across the country. Now, successive governments have failed to deliver much-needed reform to the adult social care system. We've all got some blame and responsibility to bear. This is a cross-party challenge. It's a historical challenge. The scale of the challenge is enormous, and we need to build a genuine national consensus on the way forward so that we can make truly long-term and durable plans and end the sticking plaster politics that our country has suffered for far too long. Now, I've been really encouraged by a number of colleagues in Parliament saying that they want to work on a cross-party basis, a note of conciliation, if you like, which I think has been absent from our politics for too long. Ultimately, they want to work with me on this because they know how important it is. I'm sure that many of you will have seen the very moving video that Ed Davey did with his son during the election campaign. We absolutely stand ready to work with Ed and other colleagues across Parliament who care as passionately about this issue as we do. At the moment, we're thinking very carefully about how best to address all of the challenges that are flagged up in this report and elsewhere, and about how to build that cross-party consensus so that we have sustainable reform. And we're going to be keeping you updated on that. It is a complex and multifaceted issue, and a vehicle is going to be required to build and secure the consensus that we need so that the reforms that we put forward are going to be there for the long term. But in the meantime, we're absolutely not sitting on our hands. We're doing the long-term work, but we've also hit the ground running on things like this new deal for care professionals. Last month, we took a critical step, introducing the landmark Employment Rights Bill, setting the stage to negotiate a fair pay agreement in the adult social care sector. We want a fair pay agreement to improve pay and conditions and give staff the status and respect that they deserve. Better pay and conditions will ensure that care professionals feel valued and supported, which in turn, of course, improves the quality of care, makes the profession more attractive. We currently have 130,000 vacancies in the sector, and that is not a sustainable position. That's going to be an important first step towards building a national care service. And whilst I'm on the topic of the workforce, we must of course remember the family carers on which our system depends. As announced by the Chancellor at the budget, from April 2025, we're increasing the carers allowance weekly earnings limit from £151 a week to £196 a week, the equivalent of 16 hours at the national living wage. This change amounts to the largest ever cash increase to the weekly earnings limit since carers allowance was introduced in 1976, and it's the highest percentage increase since 2001. The Chancellor also announced an £86 million increase to the Disabled Facilities Grant. This means more people will get the adaptations they need to their homes, enabling them to live as independently as possible. More widely, looking beyond these initial steps, we know we have a long way to go to build an adult social care system that's fit for the future. And our plans need to be based on the experiences of people drawing on and providing care and support. Since coming into government, I've been trying to get out and about and meet people on the front line, the people that we all serve, to try and hear their answers to this. A few weeks ago, I went to Wokingham in the lovely county of Berkshire, and I met younger people who draw on support, their care workers, their support workers, and their families. One of these was Ross. Ross spoke incredibly passionately about his family and the absolutely essential role that they play in his care. I also spoke to Diane, his support worker, who's dedicated her life to caring for others for over 20 years. It was so clear to me that Diane was doing everything she could for the people in her care. She emphasized to me that we shouldn't be just thinking about how to manage the day-to-day needs of younger people that draw on care, but that she also emphasized that these people have a huge amount to offer. And we need to be thinking about creating opportunities for independence, employment, and meaningful social connections and relationships, giving them the support they need to live an independent and dignified life. In 1987, my father gave a speech asking why he was the first Kinnock in 1,000 generations to go to university. He had the right answer. It wasn't that our forefathers lacked the intellectual capability, the strength or the talent or the endurance. It was because they didn't have a platform on which they could stand. Or to paraphrase another politician of the 1980s, it was rather like sending your batsmen to the crease, only for them to find that their bats had been broken. They were never given opportunities for education, employment, or housing, the tools that they needed to succeed. So what more can we do to make sure that those who draw on care and support aren't just surviving, they're thriving? How do we help them make the most of their talents and aspirations? Well, first things first, we must recognise that a one-size-fits-all doesn't work. Social care services must fit around the specific needs of the individuals that draw on them. We mustn't pigeonhole people into strategies or plans that might suit us from the top down, but they're not tailored to the people that actually use them. Whether we're talking about employment support for people with autism or learning disabilities, or mental health services, every intervention should be focused on empowering people to become as independent as possible. I want to emphasize another point, which is equity. It's true that society has come very, very far in the last 30 years, and this excellent report sketches that out. But while we've seen progress, we still have a very long way to go until we reach equality of opportunity in the true sense of the term. Now, as Care Minister, I will do everything in my power to make sure that all those who draw on care and support, including those living with physical disabilities, learning disabilities, and mental health conditions, have the same opportunities to access education, secure employment, and develop the social connections that so many of us take for granted. Sadly, those opportunities remain out of reach for too many. But they're not luxuries, they are necessities for living a full and independent life. Younger adults and those with lifelong disabilities that draw on care and support see higher rates of unemployment, poorer health outcomes, and greater social isolation. So we must listen to their voices, understand their aspirations, and work together to tear down the barriers that they face. To build an adult social care system that serves everyone, a system that enables people to be active participants in their communities through work, volunteering, and education. And reforming social care is key to shaping a wider health service that's fit for the future. The Prime Minister has set out the three big shifts that we have to make, from hospital to community, from sickness to prevention, and from analogue to digital. And adult social care plays a critical role in all three of those shifts. We need a robust adult social care system to move care away from hospitals and into our communities, keeping people healthy, out of hospital, and getting them home as soon as they're ready. A strong adult social care system also helps with prevention by supporting independence through early intervention. And finally, social care is well underway in its shift from analogue to digital. We're already seeing the transformative benefits of the digital revolution taking place in the adult social care system, with over 70% of registered care providers now using digital care records as part of a collective effort to move away from paper and towards digital ways of working. These are huge changes. Government can't do it on its own, though. We couldn't get anywhere close, because real change is not delivered from behind a desk in Westminster or Whitehall. Real change comes from within the teams and the communities that have skin in the game. So we need you to join us in genuine partnership. We need social care professionals, local authorities, policymakers, and crucially, the people who draw on care and support to work together. I'm confident that together we can design a system that works better for everyone, one that is fair and inclusive and puts people first. I'm committed to building consensus on the long-term reform needed to create a national care service, a service that's shaped for the future and addresses the challenges everyone, including younger adults, currently face. And our government's door will always be open to the wealth of knowledge and experience in this room as we work together as partners to make progress. In that vein, I urge you to get involved in the national conversation that we're currently having about the future of the NHS by visiting change.nhs.uk. It's the biggest conversation in the history of the NHS, and I'd like you to be part of it. Though adult social care will be considered separately, the two processes will be complementary because we are very conscious of the need for symbiosis and integration across the system and the importance of joined-up care for people. So I want to leave you with this thought. Each and every one of us has a responsibility to make sure that no one is left behind. I'm ready to work with all of you to make this vision a reality. At this conference, the light is shining on younger adults and those with a lifelong disability that draw on care. And together, we can ensure that they are never left in the shadows again. Together, we can work to deliver an adult social care system that supports them to become full and active members of their communities with agency, purpose, and dignity. Thank you very much.
Minister and Danny, thank you very much indeed for two great contributions. I'm going to open it up now for questions. Maybe I could just usurp my privilege as chairman. I've got one I just want to kick off with, which is the National Care Service, Minister. I'm not sure anybody in this room really understands what it is. I just wonder if you could flesh out a little bit the government's direction of travel on what exactly a National Care Service would be.
Yeah, thank you very much. I think that's a really important question, and what you, I hope, picked up from my speech is that we do not want to impose our vision for the future of adult social care on anyone. We want to co-design it, co-produce it, because it won't work if it is a repeat of the 2012 Lansley top-down reforms, which were dysfunctional, couldn't be afforded, and didn't work at all. So we've learned the lesson from that, and that was set out very clearly in the Darcy report. We need to create a vehicle for building a national consensus, and that vehicle has to include all of the key stakeholders and partners, including, of course, yourselves. An objective of it, clearly, is going to be the three shifts, so from hospital to community, from sickness to prevention, and from analog to digital. Those three shifts are not up for negotiation. That's the one bit of this which is absolutely clear. What we are asking is, how are we going to deliver those shifts? How are we going to create a framework that works at a national level so that we can take the best of the health and care system to the rest of the health and care system? How do we get those higher standards and a constant upward movement towards the standards that we want to achieve by ensuring that we've created this and produced this in collaboration with the people that are actually going to be delivering it on the ground? There's no point sitting in an ivory tower and creating standards that will be the basis for the National Care Service if those standards are not bought into by all of the people that are going to be responsible for delivering them. So we're going to create a vehicle. It's frustrating, I know, that we haven't been able to announce precisely what that vehicle will look like, but I can tell you that that is very much a work in progress. Once that is up and running, people will have the opportunity to feed into what they think the standards that should underpin a national care service should be. Also, what does a well-trained and motivated workforce look like? What does the financial model look like? How do we secure financial resilience for the model? How do we address very specifically the issues that we're discussing today around care for working age adults? All of that needs to go into the mix. It needs to be time-bound. We do not have time to spend years and years and years consulting and talking about this. I am absolutely conscious of that. I do feel that this time there is a sense of urgency because there is a sense of crisis. Unfortunately, there seems to be something in human nature where radical action doesn't happen until the platform is burning. We clearly have a burning platform. We have to act. We don't want to act in a way that is rash or too fast, because that won't have the traction and the buy-in from all of the people in this room and all of those that make this system work. But we also cannot afford to wait too long. Previous governments, I'm afraid, have kicked the can down the road. This cannot be allowed to happen again. So the National Care Service will be part of that process. We see it as defining the standards that everyone in our country should expect, whether it's an older person or a working age person, from the care system, and from that will flow the outcomes that everybody should be expected to be provided with as part of a national care service that has taken the entire system to a much better place.
Minister, thank you very much. That was really helpful, I have to say, and I think everyone's going to welcome a degree of co-design if that's part of the thinking. That's brilliant. If you wouldn't mind saying who you are and where you represent, because I think that will help the Minister a little bit understand some of the context. And can I just apologise, the podium is right between me and a whole cohort of people over there, so I may miss some of you. I can see the lady, though, about 3 rows back on the right-hand side, if you wouldn't mind just again saying who you are and where you're from. And I will move around the room, I promise you.
Thank you, and thank you to our guest speakers for coming today on this very important topic. I'm Amanda Jupp. I'm the lead member for adult social care in West Sussex. I have a keen interest in working age adults for various reasons historically, and I have a grandson, a 2-year-old grandson, who is disabled. I co-chair the Learning Disabilities Partnership Group on a regular basis with a working age adult, and we have good interaction with this group of people in our county. I would say to you, please, what they say to us is that they just want to live an ordinary life, do what they want to do, enjoy leisure and be employed. A number of them have voluntary positions, but they want to be employed, they want to be respected, they want to earn money. And this is very important. And I say to you again that a number of small businesses in our area employ people with learning disabilities and autism. And they have been and will be hit by the national living wage increase and the national insurance contribution. They are having to think about whether they can continue to employ people with learning disabilities. And this is really, really key. So I please ask you to reconsider our small businesses, our charities who support these people who will be hit by these increases. Thank you.
Minister.
Thank you. Thank you very much, Amanda. You've raised a really important point there. It's very, very challenging because when we won the general election on the 4th of July, we inherited public finances that are in their worst state since the Second World War. And on top of that, the Chancellor was called in, a few days after the election and told that there was an additional £22 billion of commitments that were not funded in year. So we're not talking about some, long distance fiscal event. We're talking about in-year pressures of £22 billion. And so I think to some extent we've had to, as a government, take action to get the fiscal position back onto an even keel. And that has meant having to look at tax-raising measures such as employers' NICs that you mentioned. We have, alongside that, of course, made changes to employment allowance, which for small businesses will ensure that it will essentially cancel out the impact of employers' NICs. So I would certainly encourage the small businesses in your area that you referred to make sure that they've taken a really close and careful look at the measures that the Chancellor announced on employment allowance, which I think will be a big help and help to alleviate the position. But fundamentally, we are looking at the spending review as well that's coming in the spring of next year. We recognise that this government was elected on the basis of a manifesto which had one big word on the front cover, which was change. and we have to change. We have to change the country. We have to change the way our economy works. We have to have a government that's actually based on taking responsible decisions, based on being honest with the people of this country rather than, frankly, telling them a pack of lies. And we can't carry on as we have before. So we're going to have to be honest and straightforward about the public finances, but we also have to be bold and ambitious about the public service reform that we are committed to. And I absolutely understand that some of that is absolutely requires money. You need to invest, but investment has to go hand in hand with reform. So I think the exciting opportunity we have when it comes to the health and care system is to say we've got this 10-year plan that we're producing in the spring. We've got a vehicle for building a whole new consensus around the future for adult social care. And I think if we can bring those two things together and have a blueprint for where we want to go as a country, the investment should follow that. I feel at the moment, you know, we've got to get away from a system where we're, if you like, throwing good money after bad. We've got to have a reformed system. It's a bit like, you know, you don't turn the taps on until the plumbing is fixed. So our job now collectively, and I absolutely include local government in this, is to fix the plumbing. Get the plumbing fixed, get the reforms in place, get the blueprint for reform in place, and you know then that your investment that flows is going to be flowing into a system that is productive, efficient, and delivering outcomes for patients and users.
Thanks. I'm going to take the gentleman. There's a gentleman, I think it's a checked shirt at the very back, and then there's a gentleman at the front here, and then I'm going to move over to this side and take 2 or 3 from here. If you could keep the questions quite short, so I can squeeze more speakers in.
Yeah, thank you. Alex Dale, Cabinet Member for Education at Derbyshire County Council. I'm particularly interested in the presentation was talking about SEND, and I'm particularly interested in the department's preparation for what I think is coming, because Daniel's report quite rightly referenced the volume challenge in terms of rising the number of EHCPs, but we're also facing a complexity of need challenge in terms of that rising as well. And there's also the added challenge of more and more parents losing confidence in mainstream education, and therefore a big push towards special school placements where we know educational outcomes are poorer, where we know that the children who then leave those establishments have a much lower chance of securing employment, linked to the previous question there. So really keen to understand what's being done within the Department for Health and Social Care to prepare for that challenge that is coming down the line. Pleasing to see that the Education Secretary is talking about reform of SEND. It's another, you know, burning platform, to use the Minister's quote. But what involvement will the Department for Health and Social Care have in that SEND review and reform programme as well? Thank you, Chair.
Minister.
I don't know if Daniel wanted. Did you want to say something about particularly what you said in your report?
I'm just conscious that most of the questions probably will be for you.
I sort of thought, because
Danny, if you want to come in, please by all means.
Only just to say, I think our take is, as you point out, I think the analysis so far says something like 20% of people within the HCP will need ongoing adult social care. I think there is a really good conversation about expectations with families and parents, which, for what happens to those 80% of people who aren't going to be eligible for adult social care, I think is arguably as big a discussion.
I mean, just to say that it's vital that we work together with our colleagues in the DFE. The 600 million that the Chancellor announced for social care, the additional grant funding in the budget, the debate currently going on is how much of that should be for children and SEND and how much should be for adult social care. So, you know, we have to work on the basis of understanding that there's a totality of that grant funding, and then we need to figure out exactly what share will go to adult social care and what share will go to the DFE. My job is focused on adult social care, but I absolutely recognise that, you know, it's a bit of a kind of a false barrier, really. The age of 18, suddenly it goes from one to the other. We have to have that really clear plan for transitioning, and that's something I'm working quite closely with my colleague Kat McKinnell on. We've got a meeting coming up quite soon. So, yeah, just to say, Alex, we're absolutely alive to that issue, and we know that it needs to be part of the plan in an integrated way.
Thanks. So I can take the gentleman here, and then just so everyone knows, moving over to this side, the lady, 3rd row, 4th row back, then the very distinguished gentleman at the back with his hand up.
Thank you, Chair. James McInnes from Devon County Council. And could I say, Minister, I think it's great you're here, really important, and it's really important we're talking about working age adults. My question is more general. We've had the Department of Health and Social Care for a number of years, and we're still getting a separation in the Department of Social Care and Health in terms of let's look at the NHS, let's look at adult social care, child social care. We really need, I agree it has to come from the bottom upwards, and we need people who are working in that area, working together for solutions. But we really do need a real join-up nationally that we all know in this room. Social care can't survive without health, and health can't survive without social care. And there needs to be a tighter message nationally that how those two work together and how they have a responsibility to work together.
Thank you, James. I am, my portfolio is adult social care, GPs, dentists, pharmacists, mental health, palliative care, eye care. I'm looking at Hannah in the front row, though. I think that's about it. Which community care as well. Yeah.
You get all the easy stuff.
Yeah,
really,
so I've got all the easy stuff, and it's all getting sorted. Yeah, absolutely. And you know, the reality is that I think it's very important that we have that integrated approach, and my job is to look across that portfolio. Got to as well engage very closely with my colleague Karen Smith, who's responsible for secondary care, and of course Andrew Gwynn, who's looking at prevention. One of the key messages that the Secretary of State has brought forward is that the DHSC and the NHS are one team. Senior DHSC and senior NHS officials, I should say, are in all of the meetings that I have now based on the different change delivery plans that I've put in place for my policy teams and officials. And it's very much about joining up the DHSC and the NHS. Then at the more strategic level, which I think is what you're also driving at, how do we ensure that we deliver the left shift? We have to shift from the pressure from acute into primary and into adult social care in a way that the demand is being managed in communities as close to home as possible. That's the only way that we're going to fix the system in the long term. That can only be done if you've got a strategy and a resource plan that reflects your desire to shift in that way. And those three big shifts from hospital to community, from sickness to prevention, and from analog to digital, you'll notice that they are not sector specific. They are big overarching goals that can only be delivered through very, very close integration between primary care and secondary care, and between all of that and adult social care.
Great. The lady in the fourth row back.
Thank you very much, Chair. Thank you very much, speakers. It's been really interesting.
And you are?
This, I'm Sinead Mooney, Cabinet Member for Adult Social Care from Surrey County Council. Thank you, all three of you. I'll get to my question. So in Surrey, we spend over £470 million a year providing adult social care services. We support over 24,000 people, and 13,000 people receive packages of care 365 days of the year. These numbers are increasing. When I ask our Director of Adult Social Care, she tells me what keeps her awake at night is keeping the service on the road. So I'd like to ask you, if I may, Minister, what your plans are to improve recruitment and retention of staff in the sector.
Great question.
Thank you very much. The immediate answer to your question is the Fair Pay Agreement. So we introduced the Employment Rights Bill recently in Parliament, and there's a very important section of that bill, Section 3, which sets out how the government is going to create a negotiating body of trade unions and employers, with the government playing an arm's length role, to define what a good salary and an attractive package looks like in terms of career progression, training, to get us to a point where we have a motivated workforce. We have 130,000 vacancies in the adult social care workforce. That is a massive problem. Retention is also a major challenge. The reality is, I have huge respect for people who work on the checkout in a local supermarket, but if the salary that you can earn on the checkout in a local supermarket is more than what you can earn being a care worker, which is an incredibly high pressure, high compassion, high concentration, skilled work, then we're going to continue to have that problem in terms of recruitment and retention. So the fair pay agreement, we're getting that going now. We had the first kick-off meeting with all of the key players in the room last week, and I think that's a landmark piece of legislation that is, I hope, also going to help us to take industrial relations in this country into the 21st century. In terms of the funding piece, sorry, just one final point, which is the Chancellor has now given the DHSC and the NHS its budget. It's now up to us as a team to look at that budget and to bear down on waste and inefficiency and to free up the resources that we need to secure the left shift that I was talking about earlier in my answer to James's question. So it's all about now, and the Health Secretary, the Health and Social Care Secretary is going to say more about this at a speech in Liverpool on Wednesday. It's about setting efficiency targets, productivity targets, getting a budget that actually works and using that budget to deliver the long-term goal, which is the shift from hospital to community, sickness to prevention, analog to digital.
Squeeze in one last question, Keith.
Thank you, and thank you both Daniel and Minister for the debate this morning, very interesting. 2 points.
Do you want to just introduce yourself?
Sorry, Councillor Keith Glazier, leader of East Sussex County Council. Two-part really. We're really pleased the 1.3 additional monies that's been announced for local government and 600 going to social care. Our worries also now remain on the 700 that hasn't been allocated yet, that we understand is going to be allocated on a different formula than the adult social care. And just ask you to put your plea in that actually in rural areas like East Sussex, where we have deprived areas, but actually some of these other formulas will not figure, and so therefore the amount of money coming from the additional 700 might be significantly less than other areas of need. So it's really about assessing need and population. And the second point is really, I'm sorry about the here and now.
Really got to be quick, Keith, because
sorry,
you've
yes,
got about a minute to answer.
It is very quick. We are just currently out consulting on closing social care places to meet our budget next year. And also, what do we do first? We have to look at taking away all the preventative services that once again we've worked on year in, year out to put in place, just simply to balance our budget. So what message should I take back to the good people of East Sussex about how we can follow your, and I would guess all of our agenda in this room about concentrating on prevention when we can't provide the services.
Got to stop you, Keith, because we're about to time out for the whole session. Minister.
Thank you very much, Keith. The duty of a government is to put resources where they're needed most. There are parts of the country which I think can manage perfectly well without any government intervention and without any government funding. And there are parts of the country that require support. And it's absolutely clear that we have to calibrate our funding and our resources to focus on those areas of the country that need it most. And when I say areas, that can be within a local authority area. You will have pockets where you really do need a lot of intervention and support, just as you'll have communities that need that. You'll have families that need more support than others do. That is the nature of the beast. And it's absolutely right that we have a funding formula that reflects that. We are in negotiation with MHCLG on the local government financing framework. We recognise the need to look at those formula and make sure they're working for the UK as it is now and to achieve the government's objectives. I absolutely take your point on the need for you to balance your budgets. I know that it's really, really tough out there. I know that we've got a plan which is to reform the system so that pressure can be taken off your budgets, that reform has to take place within the finite resources that we have. I genuinely believe there are ways of doing things better and in a more productive way as a team with yourselves, which can help to take some of those cost pressures off and still manage to deliver a really good service within the finite resources that we have. I also believe that we can slowly but surely start to grow the economy, and that growth is really the only way, given the huge pressures the country has, demographic pressures, pressures because of all sorts of international events which have had an effect on our economy. You know, there's a long list of issues there. That is the way, the growth is the way that we will start to deliver better returns to the exchequer, and those returns can be used to invest in our public services. So I think right now, I do think it's about getting the reform plan in place, fixing the plumbing, getting the system ready for working in a different way, making those big shifts. And as growth starts to come back to our economy, beginning to have some more investment that we can play with. But as things stand, the resources are finite, and I absolutely recognise that everyone is having to cut their cloth to fit the very, very limited and constrained resources that we have.
Ladies and gentlemen, I started by saying this was the burning platform for many of us in this hall. Reform is both morally right, but also, quite frankly, a financial necessity. And what's really good, Minister, to hear from you is the commitment to co-design and co-working on that reform, and I think we welcome that opportunity. So, ladies and gentlemen, can you just put your hands together and thank both the Minister but also Danny?
Well done, right on time. 30 seconds over. I know, and the Treasury is absolutely crucial in this. We have that cost as well. Pleasure, thank you. Yeah, it's really good. Great questions. Well, I'll try not to bullshit. We'll keep fighting. I think so, yeah. No. I guess they looked at the portfolio and said there's only so much that one human being can do. So Andrew Gwynn has public health. There's 3 ministers. Yeah, but Andrew's office is right next door to mine. Oh, sorry.
So it's all right.
Oh, you're going to go again. How are you, all right?
I'm all right, yeah. I used to work for the Industrial Communities Alliance.
That's right. I knew
Yeah, so... Oh, well, that's all the bad things in life. Yeah, nice to meet you again.
Feels hit me differently when they hit it. settle back down, please. Right, good afternoon, everybody. I'm delighted to be chairing this session. It's on climate change and net zero, the rural dimension. My name's Joan Dixon, and I'm the leader of the Labour group at Derbyshire County Council. I'm deputy leader of the Labour group, and I think that's because there was nobody else to do it. And I am also the newly appointed spokesperson for the CCN on climate change. Climate change is certainly a challenge for us at the county councils. It impacts on our services and our budgets. And we in Derbyshire have over 4,000 miles of roads that are affected by climate change, with landslips and flooding. And last year, Storm Babette severely impacted 32 of our communities. Now, counties are already working hard to meet their climate targets, investing in new infrastructure and supporting residents and businesses to make the changes they will need to meet local ambitions. But we recognise that it's a long way to go. A report by CCN in 2021 showed that the carbon emissions have increased in England's rural areas since 2005, whilst they have reduced in the rest of the country. Whilst County Council network member authorities are taking positive and innovative steps to reduce emissions, the unique and varied challenges faced in more rural areas, plus a lack of funding, have resulted in slower emission reductions than other urban and city areas. And we believe there needs to be a new relationship between central and local government if we are to deliver on net zero. And I think it's one of the things that I've worked in policy for a long time, and my frustration is that when government develop policy, they don't really get counties. It's very urban focused, very unitary focused. I was really frustrated at the LGA conference a couple of weeks ago. Counties barely got a mention. Well, anyway, less of me. We are delighted today to be joined in this session by Victoria Vivian, the President of the Country Land and Business Association. You've been the President for a year now. The CLA is the membership body dedicated to supporting landowners and rural businesses. As we all know, rural landowners and businesses play an important role across our member areas, contributing to our economies, and they are a vital partner in delivering net zero. I know that you will be interested to hear from Victoria about the innovative work being undertaken by the CLA members and to hear more about the CLA's asks of government and local authorities and how we can work together to deliver a net zero future. And I also think that you talked with some people last night and they were keen to get your thoughts on some of the announcements in the government last week. I wonder why I got given this session. So, yeah. So I'll just hand over to you. Thank you very much.
So, everybody, first of all, if I had my way, we'd be standing outside because we've had a long session, really thought-provoking, really important conversations this morning. But I am a better person when I'm out of doors. I'm nicer, cleverer, more energetic, much more smiley when I'm out of doors, and I actually believe everybody else is as well. So I'm going to take my jacket off straight away, and anybody else who wants to is very welcome to. And were I at home, I'd go now to the back door, and outside the back door would be my Wellingtons, and on top of my Wellingtons will be my waterproof trousers, which we put on at the beginning of November onto our wellies, and we just step into the wellies and pull up the waterproof trousers until March, really. So my backdrop you're in your drones now. You're no longer here. You're flying free with the cool, damp breezes of the Atlantic blowing onto the Lizard Peninsula in West Cornwall. I'm standing in a cabbage field in my normcore clothes and my wellies, my arms out, and it's raining slightly, because it always does. And I'm standing on a ridge to make myself look a bit taller. And behind me, as you circle round, you'll find the Fugu in an ancient hamlet. And a Fugu is an Iron Age underground dwelling. And that hamlet there is the longest continually occupied space in Northern Europe. And spin round me. So we've got our food, we've got our heritage. Spin round me again and look the other way, and you'll see the Gunhillia satellite stations communicating with deep space. And that is the spread that we have in that external world that is the rural economy. We are the most high-tech companies, and we are the most rooted in our place. So here's the CLA. I know lots of people would think that the CLA is a lot of landowners, possibly farmers, clinging on to what they've already had. But actually, we are 26,000 members. We are, yes, farmers, yes, land managers, yes, institutional landowners. Amongst our membership, we count the church commissioners, quite a lot of the utility companies, the National Trust. We're a big collection of people managing land. And we represent about 11 million acres of land. So those of you running your local authorities, you will always be a very short phone call away from all the help and information you need from the CLA. And what do we do? Well, it's bloody difficult, actually. I'm just going to let it out there. This is a bit of a therapy group, isn't it? We're all saying it's quite difficult. What we're expected to do is grow food, hence the cabbages. We're also expected to grow energy. So we've got to give up that land for energy. And sometimes it's quite easy, putting up wind turbines. I did mention the wind, didn't I? So putting up the wind turbines, yes, but also solar panels, anaerobic digesters. We are energy specialists across the board. But every time you take a bit of land out to make it energy land, you stop making it food land. But that's not stopped there. We're also housing. We did a benefits of land ownership survey about 3 or 4 years ago, and that told us that social housing provision amongst my members represents a huge percentage of the social housing provision in rural areas. We let more than 50% of our properties at lower than commercial rates, and we continue to do it in the face of an awful lot of headwinds. Frankly, wind again, headwinds. So, and are we there? No, we're not. Oh, that's it. It says stop. So where are we? We are also expected to deliver access, because people need access to land. It's not always easy to make that healthy and safe. And finally, I'll cover a moment, we're expected to deliver on nature. So we can all have a little bit of a group thought about that. And it's against quite a complicated backdrop at the moment. You might have noticed that we're up in arms about agricultural property relief. And the reason we're up in arms is because our businesses have minute margins. We work on such narrow profit margins that no genuinely big business would ever touch it with a barge pole. Our return on investment hovers between 1% and 2%. So how do we cope with that? Well, we go to the banks, because we don't have a pot of cash lying around that we can just bottomlessly draw on. We go to the bank and we ask them to lend us money. And we ask them to lend us money over a long period, because we haven't got the money to pay it back over 5, 10, 15, 20 years. Even more, we go to banks like the Agricultural Mortgage Company, who lend over 35, 40 years. And they're what we call walk-away lenders. So once you've done your stuff, they get the money and you carry on with the loans investments. In this kind of environment, in this post-agricultural property relief environment, one of the big questions government is going to have to ask itself is, where the heck are we going to get that money? Because what bank is going to lend me money on, well, especially me, my age, who's going to lend me money on a 30-year term? And the answer is nobody. So there's lots of ramifications. When you hear farmers up and down the land kind of tearing their hair out, what they've got left, about the situation in farming, it's because we cannot do those other things if we don't have the confidence and the longevity to invest in our farming businesses, to invest in housing, to invest in the environment. So one line, which I think is a defensive line, in all honesty, from government, is to dismiss it and say we don't properly understand the announcement, which, of course, makes everybody feel quite riled, to be absolutely honest, because a lot of these people are running very, very big businesses as well. So, on the one hand, we've got these other, and we've got national insurance contributions. We've got an economy that's depending on us in the rural space. A tractor sales team in the East phoned us up the other day to say their national insurance contributions have gone up by $500,000. And because they've gone up by $500,000 a year, they are going to be laying people off. They are going to be closing that particular deal, one of the dealerships. And I can't see how that's growth. That's my real problem with this. How is this growth? How are we, the people running businesses, and I bet a lot of people in this room run businesses as well, how are we going to find the money, A, to invest, B, to create the security to borrow, and C, to pay an enormous tax bill? And they said, it's all very well, you don't really understand, double problem, you're just a farmer and a woman, so what would you understand about tax? Well, what I do understand is that I don't have £300,000 a year floating around in my bottom line that I can commit to paying a tax like that. So I really hope all of our lobbying and our collective lobbying is going to work to draw back on some of those stings. And the backdrop is agricultural transition. The backdrop is the loss of the basic payment scheme. The backdrop is a new minimum wage. We don't pay minimum wage, we pay way over minimum wage. But what has been failed to be recognised is that when you're paying way over minimum wage, you have a differential to maintain all the way up through your staff. So it's not the people at the bottom who are getting the change. Everybody will come to me in the next year, probably the next 6 months ago. I hear you're giving them an extra £1.50 over the national minimum wage. I need that as a percentage of my whole wage. So, and that's going to have a big effect, obviously, on NICs. So why am I talking about that when I'm supposed to be talking about natural capital? And the thing is that the more you squeeze our businesses, the less able we are to make that vital contribution to improving our natural capital and coping with the climate crisis. If I look back across my own business over the years, so let's go back to that cabbage field, okay? I'm still there, hands outstretched, receiving the benefit of rain, which 3/4 of the world would be much more grateful than me to see. And actually, those 5 fields around the mount, before we get to the Fugu, and before you get to the moor, are pretty typical of the way we will have managed land in the last few years. So it's good land, actually. And that little bit I'm talking about is probably only 150 acres around there. We spend a lot of time growing potatoes. We followed the potatoes with daffodils because it's a good crop. It's a good way of cleaning the land. And we followed those with brassicas. Again, it's a good way for cleaning the land. Because those are really, really good crops to grow, they're very valuable, we allowed triple-size headlands. We can afford to expand the headlands around those fields for nature. We haven't had them in any schemes. We've just done that because that's the right thing to do, and I want to be on the right side of history. And now, I feel that piece of land has done its job, actually, for the last 40 years. It needs a rest. It's been hyper-productive for a long time. We've coped with a lot of flooding problems that we used to have up there. We've put in big bunds to stop the runoff. It's in a much better place. We mow some of those headlands because owls can only hunt in short grass, not in long grass. So you have to create that. We're not in a scheme. We just do that because it's the right thing to do. And now we're putting that piece of land into a biodiversity net gain project. We're actually extending it. It's going to be about 200 acres of BNG. And we're working with the Environment Bank because it's not my trade, you know. I think I could probably mess up trying to get into a contract for BNG. I'm obviously going to be doing it with Cornwall Council, and we'll be able to look at how we're going to do that project together. But it sits on the back of, and I'm speaking anecdotally because it's a little bit helpful, that this is just one of our members, me and my husband and my family. We probably went into our first environmental schemes in 2000. We built our first carbon neutral houses in 2004. Where was everybody then in 2004, busily denying that there was a climate crisis? I've read Rachel Carson's Silent Spring. That was printed in 1968. We all knew that this crisis was coming. And so we are working, and a lot of our members are working at creating projects. And then we're putting those projects together to make bigger projects, because nature specializes. It's a really beguiling idea that we can create a landscape which looks a bit like a Constable painting, a little bit of nature here and there, interspersed with plough, furrow and fold, you know, and that would be great for nature. But the fact is, nature likes great big lumps of nature where you mostly leave it all by itself. So we need to join up and make those corridors. We can put in nature-based solutions. So a little bit out towards the satellite station there, you will see we have a Lowland Heath restoration project. We took about 80 acres of failed Sitka down. We received so much hate mail because we just left it. We walked away. It looked like a Paul Nash painting from the First World War for the first 8 years. I was amazed we survived at all. And we have allowed that to come back. And so Erica Vagan's The Wandering Heath is a unique heather that grows on the Lizard. And if you've never been to the Lizard, it has the greatest botanical biodiversity in the United Kingdom. It is an amazing place. The Erica Vagan's is unique to us. So could I have left that being food? Yeah, I could have actually got rid of the Forestry Commission stuff that was there, dug out the stumps, put in potatoes. We'd be a lot better off if it was potatoes. But actually, Lowland Heath is a vanishingly rare habitat. That land is so much better off being part of a Lowland Heath restoration project. And these are the judgments that my members and I and the institutions we work with are taking all of the time. So I suppose I'm coming to the notion that we are not the villains of the piece. We are your very best helpers. Where you need these relationships, we can step in. And we had a pilot in Cornwall for the LNRS project, so moving a little bit into that direction. We were a pilot county for that. And in the first instance, and believe me, I love my council. I'm immensely proud of them, and I brag about them relentlessly wherever I am in the country. I go, oh, well, it seems very nice, but it's not as good as Cornwall, obviously. Second best, possibly. But nobody spoke to us in the first iteration of that LNRS project. Fortunately, we're extremely active in the CLA, and when we saw the pilot coming towards us, we went out and they said, oh, we didn't really know about you as one of the stakeholders. You know, we've been stakeholding with these various other people. And I said, but yes, let's put that behind us now. Let's absolutely, you know we're here. We know that probably with the institutions and the duchy and all of these other people who are in membership, we probably represent 50% of the land that you need, well, in Cornwall, and definitely that you need to work with. And there's another beguiling idea that it would be really convenient to deal with this in 80-acre holdings, but it isn't for nature. It's really good if we can cluster up with those smaller land holdings. Because if we can cluster up and come to you and say, instead of the Vivians with their wretched 200 acres of BNG, you know, if Cornwall Council needs it, we can come with 500, 1,000 acres to go straight into these projects. So we are alive to the problems, we are competent, we are data-driven, and we are already, not personally, but in membership, in landscape recovery projects. And that's where we need perhaps your help as well, to push back against the government, who'd quite like to quietly shelve landscape recovery. which is going to be massively important because, as I said, nature is best done at scale. My sister still farms our farm on Dartmoor, so if there's anybody from Devon in the room, I'm really a Dartmoor girl. And we up there, where we have different opportunities for nature-based solutions, she's both a freeholder and a commoner on the moor, are using the higher moor for those nature-based solutions to slow down the water. Slowing down water upstream, speeding it up downstream. That, in a nutshell, is what we have to do. There's a lot of stuff in the middle about cleaning it up as well, but, you know, from the point of view of the nature-based solutions. And we can really do that. The next step is washland agreements. We can store water, not on Dartmoor. It's got gravity working in its favour. But across the country, across our membership, we can store water in very significant quantities, but we can't do it for free because it is costing us to take an entire crop out of production for that period. So we have to go back to government all the time. It's not because we're greedy or grasping or anything. We're saying we are trying to run a business. And in order to do that, if I'm going to have to tie up land, originally washland agreements thought that we'd have a flooding event at the very most once every 15 years. We're now having flooding events every year. And it's ridiculous to expect that payment to have carried on for that time. So we've got the biodiversity net gain. That's very much in your ballpark as the county councils, finding the people and the ways, and there are intermediaries to scale it up. We're also looking at carbon capture. So we've got that market, that biodiversity net gain market is a public market. That's controlled by all of you in the public domain. But we have private markets coming through as well, and they are not easy to manage. Obviously, we are at the very birth point of carbon trading, and we're all being advised not to sell our carbon because we don't know at what point we're going to have to inset our carbon. So if I've got a 1,000-cow dairy, I don't want somebody to come back to me in 10 years' time and make me buy my own carbon back for 5 times the price. So a lot of people are waiting on their carbon. But also in the international kind of trade, nobody's going to get out of bed for £100,000 worth of carbon, 500. They're waiting till we come to them and say, we have bulked it up to these huge tradable quantities. I don't know if anybody in here has been involved with the Woodland Carbon Code, which is at this point the only working carbon code in the country, and it works for the peat as well, and it's not easy. You know, you need an advisor to get through the arrangements. But those public markets are coming. And it looks like they're going to be needed. But if we want everybody to work together, we do need both. And because I know you want to have your lunch, and I also know that you want to maybe you'll have some questions, I'm going to leave you on a much, much more provocative one. The most difficult, carbon expensive product that we're bringing into this country is critical minerals. And yet, across the granite band that runs down through this country, we are still rich in critical minerals. We need to be thinking that that is the carbon-saving solution, is to start using our own tin and our own carbon. I know it sounds poldark if you're not in that world, but it's absolutely... We signed our first mining leases last year. South Crofty looking to go into production for tin next year. Now, this bit you might not know. You know all the rest. You know how important critical minerals are. Tin is held in horizontal strata. You know, if you're with a hat and a candle on the front of it, you could crawl along and hack it out in the rough and take it out. Lithium is held in vertical strata all the way through those tin deposits. We know the lithium, well, we know it's there because these days we can measure it, but we know the lithium is there because it's held in brine. And that's why in Bolivia you see those huge lithium soaking lakes. If we can lift the lithium out of our West Country particularly, but anywhere where you have a granite batholith, you will have these minerals. If we can lift that lithium out more cleanly than it can be done in Bolivia, imagine what an injection of real investment that would bring to the country. Not foreign investment, Why aren't we talking about building our own businesses? I was bewildered by how it can be better to bring in foreign investment and bankrupt all the businesses that you've got in front of you. So I'm going to leave you with the, you know, Warwickshire are here. Warwickshire led the way with a couple of other counties on biodiversity net gain. And so I'm going to leave you with the thing that they told me maybe 8 years ago. The one thing that's almost impossibly difficult is to actually make a biodiversity net gain. It's super complicated. Building an ecosystem from the ground up probably takes, at best, 15 to 20 years. So you mustn't expect to see results, and sticking a beaver on top of it isn't doing anything. Sorry, James, but it's true. Introducing charismatic mammals is convenient, but it's not going to solve our biodiversity problems. Our biodiversity problems are going to be solved by us at the CLA, by you in the county councils, and very much from the bottom up. Thank you. Has anybody got it? I'm used to a lapel.
No, I'm doing that bit.
You do?
Because I'm going to choose women first on this occasion. The lass at the back in the black, please.
It's you.
Thank you very much. Denise Turner-Stewart, Deputy Leader, Surrey County Council. Food security is very much at the forefront of public opinion at the moment, and I would hope that the majority of us are right behind the farmers when it comes to the latest challenges that are being presented by the Labour government. Just in terms of solar farms, I mean, there's research shows that you get surface runoff, which can actually pollute the land. I know there's an argument that you can graze underneath them, the land isn't sterilised, it can be returned back into food production after 30 or 40 years. Actually, that's highly unlikely, and actually once you've dedicated that land to solar farms or renewable energy, you're unlikely to recover it back to a quality suitable for food production and human consumption because of the toxins. So I just wondered what your view is on that, because there's obviously a big competing sort of market out there trying to hoover up our food production land. What your view is on that? Thank you.
The good news is we absolutely aren't going to starve. You know, I did the Chalk Valley History Festival back in the summer, which, by the way, was an amazing thing. I wish I'd known such a thing existed as people dressing up as history when I had children at home. But and the question that I often get is, you know, what are you going to do when there are submarines in the North Sea? You know, what are we going, the people harking back to the past and perhaps reflecting those current fears about security here in England and the United Kingdom. And the young woman who was on my panel gave me the perfect answer to that part of it. She looked straight at this person and she said, when the call comes, my soil will be ready. Which I think is such a clever answer because it's not an immediate answer. You don't need to be ready growing it now. You need to be ready to grow it when that happens. And she's an amazing farmer, so her soil will be ready. What I think they're doing collectively, we've been a bit numbskull about, is every single industrial estate should have solar panels all the way over the top of them because they also have capacity for groundwater runoff, although the utility companies tell me they shouldn't get that access to sewage free. And so that's a big area. If we could get not a very significant amount of money at all to reinforce our farm buildings, we could cut, which are enormous these days, they are absolutely enormous, we could put solar on those. So I think it might not be the 15,000 acre solar park that's going to get you re-elected in X, but definitely not re-elected where the 15,000 acre solar park is. But I think I'm a great believer in nibbling away at the problem. Let's reduce the problem here. I think our offshore wind is an incredible opportunity. The Crown Estate now has all of this capacity to bring offshore wind from deep water, because the reason it's all in the North Sea is it's so shallow, but from deep water. And I think that is another massive opportunity, but we have, I'm not sure if I met somebody from Suffolk yesterday evening. We have a member in Suffolk who happens to have a long, thin holding, and there are 5 new sets of pylons planned to cross his farm because nobody can get it together enough to make one point of entry and stick one set of connection across land. So I think, personally, I think it can be done, but it can't be done the stupid way it's being done at the moment.
Have we got any more questions? Gentleman at the back there, please.
Thank you. Richard Bell, Deputy Leader at Durham County Council, and my division represents about probably a fifth of the actual landmass of Durham, very rural. I've got 7 reservoirs in my division, and about a decade ago I asked the Chief Exec of Northumbrian Water, why don't you do any hydro generation at your reservoirs? And he said, love to, Richard, but we've looked into it. It would cost millions to put the electricity infrastructure into place to take the electric away, and nobody will pay for it. Local supermarket, Lidl, opened up, couldn't put in fast charging points for EV cars. Asked them why, they said, love to, Richard, but the electricity network isn't capable of handling it. I've got constituents now wanting to put charge points in their own houses, being told they can't because the electricity network isn't up to it, put in for the electric light back in the 1950s. So when my constituents ask me, what should I do, should I just say, I'd stick with petrol and diesel if I were you until they become absolutely obsolete, and hopefully by that time government will have thought of something to do about it. But actually this continual preaching of people to go down the electric route in rural areas just doesn't work. Oh, and I could mention the power cuts, etc., and the storms, as I did to Kwasi Kwarteng, when he was at a hub, when the electric had fallen off, and I pointed to a coal fire and said, but for that Kwasi, this place would be cold as well as dark.
And it is very cold.
And he didn't have an answer to it. So there you go. Infrastructure. What can we do about it?
Well, we do have a special department on infrastructure, and the infrastructure is working through power infrastructures to telecommunications infrastructures. I had the happy opportunity to be interviewed on College Green outside Westminster, almost like I was a real politician. And they said, you know, how do you feel about the delay in the rollout of connectivity, telecommunications connectivity specifically, that was. It's been delayed to 28. I said, but I don't want to make a phone call in 2028. I want to make a phone call tomorrow, or even today, or even yesterday. To make a phone call at home, unless you are able to use a landline, you have to go and stand on the top lawn, rain or shine. That is the only... And it doesn't stay in the same place in the weird way of connectivity. You have to canter gently around to keep in touch with people. There's no way to run a business. We had to pay a lot of money. Fortunately, we got a grant as well from the council and from the project that was running at the time to bring super fast broadband down to the farmyard so that we could start more businesses and grow our businesses and pay our rates and do the right thing. And hadn't got nowhere until, again, I had a happy opportunity to stand up there and say on the BBC News lunchtime that it was a disgrace that rural areas weren't getting any help to get super fast. And miraculously, I got it within a year. So that doesn't... So those are... When we're building infrastructure, we need to build all of it. And the electrical infrastructure is antediluvian, undoubtedly. It has been reinforced, and the Somerset people will know this, it has been reinforced east of Hinkley Point, ready for the new nuclear power station, but anywhere west, no point in even trying. I'm afraid my own reaction is I'm going to build a sign, and I'm heading towards the sign inside the gates at home that says, Trella Warren, you're now off-grid. And we'll just do it all ourselves because we're so bored with waiting to be able... I'd love to be able to send it out to our local communities. But anyway, there is a power cable coming from Morocco, which is coming all the way through the Straits of Gibraltar. Now, they do have lots of sun, so I can completely understand why they're very well placed for PV. So through the Straits of Gibraltar, across the Bay of Biscay, around Land's End, and up to come on shore east of Hinkley Point, because that's the first place it can arrive in this country where there's a grid fit to take it. So we campaign on reinforcing the grid all the time, and I'm sure all of you do too. I think people are feeling hungry, but there's an arm.
Yes, yeah, so take this as the last one.
Last one.
Yeah, please.
Thank you. Lucy Nethsinger, leader of Cambridgeshire County Council, but
in membership, everybody, Cambridge County Council.
Also Cornish girl, born and bred, I'm afraid. So I have loved hearing about the lizard. And my question is actually about the lithium that you were talking about.
Yes.
Which I think is a massive opportunity for this country, but it is also, to some extent, an issue because I happen to know that most of the mining rights under Cornwall are owned by either Lord Falmouth or the Duchy of Cornwall. And
Or coincidentally us, yes.
Okay,
but we're not going to make the profits. We're not going to make the profits out of those critical minerals. We'll get a rent, but the profits will go to the companies who do the extraction.
So my question really, and it refers back to some of the conversations we were having in a previous session about making sure that local communities benefit, because I think it's going to be difficult to make the case for that kind of mining, but I do think it is something that the country ought to be thinking about. People are only going to be willing to accept it in the same way that they're only going to be willing to accept huge solar farms or Google data factories if the people living nearby actually benefit from it. So is that something that
completely? But what we don't need is any more blimming village halls. I'm so fed up with infrastructure projects that would like to give me £250,000 to build a village hall. I've got a village hall, actually. I've got 3. So we've exploited that bit as much as we can. What I want is for them to build something and go, and the benefit for your community is something long-term and long, that has a sustainable future. I do know, because I know about South Crofty, that the water coming out of the dewatering plant at South Crofty is cleaner than the water in the Red River at the moment. So if it's something that people associate with kind of negative nature outcomes, to put it politely, then that's where some of that money should go. Absolutely. But the great thing about the planning system at the moment, I'm going to big up some of the planning, is it puts incredibly stringent rules on mining. And I mean, it seems probably if you don't live in a granite batholith, this probably seems a bit irrelevant to all of you. But it is what I think my real point was. We have these incredible opportunities in rural Britain to engage with heavy industry effectively and to do it in such ways that everybody, the biggest complaint about South Crofty is you can't do it here, it's a mining heritage site. And you go, yeah, the trick is in the mining. And I think it would bring exactly, for us, I've given you Cornwall specific. I could probably do it Lincoln-wise as well if I was in Lincoln. But the point is, we need to be, I'm still a bit bitter about that first comment about bringing investment in. We have the capacity to deliver on creating growth. And at the moment, we're just being strangled for growth. And it's the wrong way round. It's back to front. And I don't think it's going to work. Thank you, everybody.
Okay, so I think we've clawed back some of the time that we lost in the last session. Thank you for that very stimulating and provocative, I think, talk. 2 o'clock is going to be the workshops, and then back here at 3 for the presentation from Claire Ward, who's the East Midlands Mayor. Lunch is in the conservatory downstairs, okay? Thank you very much. Thank you, Victoria.
Thank you.
You're welcome.